Thank you for joining us. Again, my name is JD Davidson. I'm actually one of the directors of education here at Abyde. I'm excited to be presenting to you today on North Carolina Dental Society's virtual event. Every time we get a chance to educate NCDS members on HIPAA compliance, it's a great opportunity for us. And we hope today's content will be valuable to you and highlight the need to pay attention to HIPAA as we roll through 2021 and beyond. Abyde is the North Carolina Dental Society's preferred HIPAA compliance partner, and we're honored to be chosen as a vehicle to keep NCDS members up to speed on HIPAA compliance and also provide the easiest solution in the industry to relieve HIPAA headaches as well. Now, as things start to heat up around the country for almost everyone, the OCR has been on a steady hot streak as well, with enforcement when it comes to HIPAA, patient complaints, data breaches. We'll take some time today to cover where they've been focusing these efforts and how to best prepare your practice for the coming year and beyond as well. As we dive in today, we're going to be covering overall OCR enforcement trends seen over the past year and what we can expect to see into 2021 and seeing a couple years forward as well. We're going to focus on some key areas for your practice to prioritize. We're also going to identify where HIPAA is headed, including the recently passed HIPAA Safe Harbor Law, and also some proposed changes to the HIPAA privacy rule as well. And last but not least, we're going to speak briefly on how Abyde's revolutionary software solution makes keeping up with all of these new changes and heightened government enforcement trends very, very simple for your practice moving forward. To set today's stage for the webinar, let's kind of wind back the clock a little bit to the bigger picture. If any of you have attended one of our webinars or events in the past, you've probably seen these before. We talk about them so often because they're key factors in a complete compliance program. Protecting your patient's sensitive data is, of course, what HIPAA is all about, right? And each of these pieces plays an important role in doing just so. Just as the puzzle wouldn't be complete if it was missing a piece, protecting patient data and meeting HIPAA requirements is only made possible by all of these pieces coming together and having the documentation of your organization's culture of compliance to back that up. Most practices understand the importance of protecting patient sensitive information, but it's this proper documentation and required documentation of compliance that actually protects the practice from being fined or an audit. So it's this documentation that often falls between the cracks a bit. And again, as we talk about the recent OCR data and trends, this is often what gets practices into trouble, is that lack of overall proper documentation. So first, let's dive into HIPAA enforcement data and from the past recent 2020 release of some of these audit results. So these results of the enforcement trends just released this past December, what they show is actually some good news, but also bad news. Good news is it shows that less than 6% of covered entities actually have an appropriate government standard meeting ongoing risk management program. It's a pretty staggering number when you think about just how much patient data is out there, potentially unprotected, without the required HIPAA safeguards in place. The bad news is the government understands this. They recognize practices aren't meeting these minimum requirements, and they're going to continue focusing these efforts on these areas of what we consider hotspots. You can see a lot of these key areas of focus: notice of privacy practices. A lot of practices failed to provide that required document to the patient. You can see patient right of access, another one. We're going to talk a lot about that today. A lot of practices don't meet those minimum standards in either providing patients or records in a timely manner or even in the right format that was originally requested. Notifying patients of a breach as well. Notifying patients in the right time frame can be specific to your state. There's also federal guidelines to that as well. And overall, the security risk analysis, and again, overall completion and implementation of a complete security risk management program. You can see these common themes around the country: patient right of access, basic HIPAA requirements, handling breaches correctly. You can bet the OCR knows this. They're going to continue on enforcing, again, until they see a better percentage of completion of these minimum requirements. What else can we take away from this data? The OCR just doesn't think that practices aren't compliant. They've now got evidence that practices just don't understand what a complete HIPAA program even means. Just a few examples of this: that some practices submitted irrelevant documents when asked for their security risk analysis, or that SRA, which is the very first phase in any compliance process. It's the first requirement under the security rule. like a patient's insurance prescription coverage and rights, a document discussing pharmacy fraud, waste, and abuse, has nothing to do with a security risk analysis. None of these were actually meet the requirement when they were requested from the practice. Other examples where practices are truly just not informed, many of them submitted a document from their IT company, which may or may not cover some technical aspects of HIPAA, but doesn't qualify or even come close to a full HIPAA program or even government standard meeting security risk analysis. Some practices even thought that a generic document covered them when it comes to policies, things like the Notice of Privacy Practices and more. Some even gave different entities Notice of Privacy Practices or a super generic version that didn't even reference the actual practice being audited or the right information on their policies. While some of these examples might give you maybe a little bit of a chuckle here today, they showcase just how much misinformation is out there on what it actually means to be HIPAA compliant to the government standards. The OCR knows this, the practices are that far off the mark. So again, they're going to continue on enforcement and make sure they make it clear what's actually required from their practice to be quote unquote compliant. Before we dive too much into some of these privacy rule changes, let's just do a quick refresher on the history of HIPAA compliance. I'm not going to give you a 30-minute history lesson on HIPAA actually, but first, you can just see that HIPAA is not a stagnant law. One of the common misconceptions is that HIPAA has been around since 1996, hasn't been that many changes. It's actually quite the opposite. We've seen a lot of changes, a lot of adjustments, and we're really starting to see enforcement trends finally catch up to some of these changes we've seen over the last couple of years. So let's start with the fact that these changes are just starting to be proposed and they haven't gone to full implementation yet. The way the law works, these changes will first be reviewed for a comment period of 60 days. Then, once these comments are reviewed and incorporated, the final updates will be published. Even at that point, there will still be a significant period allowing practices to implement these changes before practices are going to be fully held accountable. So while we don't advise making these changes yet, here's what you can start to anticipate on these proposed changes. First, these changes are going to strengthen individuals' rights to inspect their PHI in person. Some of these proposed changes include allowing individuals to take notes or use other personal resources to view and capture images of their PHI, kind of like taking a photo on their cell phone of your computer screens is a really good example, and even reduce identity verification burdens on the provider. Reducing identity verification burdens on individuals trying to access records, which also includes patients and their personal representatives. They're also going to be shortening covered entities require response time to record requests to no more than 15 calendar days, which is actually at currently 30 days. And also possible extensions to no more than 15 calendar days, again, currently 30 days. This change is not unexpected and again, mimics the current focus on patient right of access. They're also talking about modifying the process around the Notice of Privacy Practices. You could also see creating a better pathway for individuals to share their PHI in an EHR and other covered entities. Specifying when electronic PHI must be provided to the individual at no charge, and also requiring posting of fees related to patient records. They're also discussing adjusting the quote-unquote minimum necessary standard as well. Again, all these changes are only proposed. As that final rule actually gets published, we highly recommend making sure your HIPAA program is updated, or even better and less stressful, choose an outside HIPAA vendor who can interpret all of these legalese for you and will automatically update your policies and information moving forward. So kind of some enforcement trends, probably some scary updates. Here's some good news. The government has actually taken a really big step to try to incentivize practices to protect themselves from HIPAA fines. Now, I know this is probably not earth-shattering information on a Wednesday afternoon, but under this new HIPAA Safe Harbor law that was just enacted January 5th of this year, 2021, they're encouraging practices to implement HIPAA standards that meet both federal and state HIPAA laws. By doing so, they're actually going to reduce penalties for those who are compliant should there ever be a HIPAA incident like a data breach or a complaint. So the government, through collecting data the last several years, has seen a lot of these reasons that audits are actually triggered. Patient complaints, data breach are almost completely outside your control. What this HIPAA Safe Harbor law is saying in layman's terms is, hey, we understand things happen, If your practice can provide the required documentation and show that you meet the government standards for at least 12 months prior to that complaint, prior to that data breach, they're going to minimize fines, they're going to minimize audits, they're even going to minimize a corrective action plan, or more than likely all three. So this is a really big step from the government. I really want that to sink in, that they're making an effort to say, hey, all we want you to do is to meet those minimum standards. We understand things happen. So this major lack of compliance and awareness of what HIPAA requirements actually are has also led to a rise in patient complaints, surge in healthcare data breaches, and ultimately record-breaking OCR enforcements. So here's just a few areas that we expect 2021 to continue these enforcement trends in, and also some red flags for your practice to keep an eye out for and be aware of moving forward. If you guys recall from earlier slide, talking about the recent audit results, only 11% of organizations audited actually met the patient right of access requirements. Now, patient right of access has been on the OCR's radar for quite some time. And in 2019, they officially announced an enforcement initiative to target non-compliance in this area specifically. Fast forward 19 months, and they've announced 16 right of access violations and collected over $1 million in patient right of access fines, proving that this is definitely a key area of focus in their continued enforcement efforts. So to best avoid finding yourself in the OCR's right of access violator hot seat, your practice needs to have specific written policies that address all requirements of record request processes, including your practices first knows who can request records and avoid saying no to a legitimate request. Requests for records may come from either the patient themselves or from a personal representative. Now, a personal representative is someone with the authority under state law to make healthcare decisions for another individual, like an adult or a minor. And also, making sure we have a written request in place. HIPAA law does not specify any required method of requesting access. However, your practice can specify the way you want patients to request access. They just have to be informed first about this requirement, reinforcing the importance of documentation. Asking for a written request is always ideal for your practice to document that date formally. Additionally, the HIPAA privacy rule requires practices to take reasonable steps to verify the individual making a request for access is who they say they are. It's extremely important for your practice to use professional judgment when determining that a request is legit or confirmed or real, but you must make sure verification is done without adding unnecessary delays in fulfilling that request. As a side note, this is something included in the proposed changes to the privacy rule to make this even easier and again, reduce those delays in fulfilling requests and reduce that burden on the actual practice. Another one here, the privacy rule also requires a practice to provide access to records in the format they were requested. So either a paper or electronic copy. If the records are not readily producible in this requested format, you'll need to agree on an alternative format instead and document that agreement. Practices have been fined specifically for not following that formatted rule or on the requested records initially. And lastly, patients can only be charged a reasonable fee for those records requested. Part of the proposed privacy rule changes is an increasing emphasis on providing records electronically for little to no cost. Please don't shoot the messenger here, but acknowledging that fees should be limited, if levied at all, can prevent your practice from getting dinged for unreasonable cost to patients down the road. So to emphasize why patient right of access really needs to be kept at the top of your practice's priority list, let's look at some quick highlights from some recent enforcement examples and really learn from others' mistakes. Really good example we've seen over the last couple of years. This is a really good example of 5 new fines recorded in just one day. Now, the reason these were so news and noteworthy is not because they were so large, but actually because they revolved around small independent practices. These practices range from, again, single location, multiple location, but you can see they all revolved around patient right of access. One of these practices took almost 36 months to get their records back to the patient. The federal law is required within 30 days. So it just gives you an idea just how far off they were. And again, these fines range from $3,500 to $160,000, But that $3,500 fine just shows you the length the government's willing to go to keep stressing the importance on patient right of access. So what can we learn and take away from these other mistakes? We must meet the right time frame in providing their patient records, and also having proper documented policies and procedures for providing access to those patients for our employees to adhere to. Now, these right of access violations weren't the only money makers for the government this past year. And you could see almost 95% of the fines last year in 2020 were related to one specific area. That's cyber attacks and cyber related breaches. Now, keep in mind, again, these fines were not just levied because these practices were unlucky and had a random cyber attack. These fines were levied because this data breach or the cyber attack actually acted as a trigger point for a full-on HIPAA investigation. And what the government finds is what they call systematic noncompliance, which is a really fancy way to say that practice is not meeting those minimum standards. So what should this tell you, and what it tells us, and we hope everyone on the webinar, is that these triggers for these investigations in the majority of cases are completely outside the practice's control, but still led to a whopping number of fines and breaches because, again, they didn't have the HIPAA basics and minimum requirements in place to prove their compliance to the government. So let's take away some key notes for your practice to keep in mind as we move forward as well. 2020 saw a record number of cyber-related breaches, both from covered entities practices and also business associates. In fact, we know a number of our current customers that had business associates affected by these breaches. So it's essential to have also those business associate agreements signed with all of your vendors that have access to patient data before a breach occurs. Super important with all these fines, it wasn't necessarily, again, the breach that caused the fine. It was because these practices had no formal HIPAA program in place and they were missing those key HIPAA requirements to prove their compliance. Again, having a complete HIPAA program is a huge part of cybersecurity as well, running through that risk analysis, identifying those technical safeguards. And lastly, these fines related to cybersecurity included one up to $1 million for a single fine, given to a practice who had an unencrypted laptop stolen, who actually failed to have a proper asset log in place. Now, they didn't get fined because they lost a laptop. They were fined because the practice had done a poor job at tracking where this sensitive data was being held as well. So what should we do to not end up like these practices? And again, learn from their mistakes. We want to make sure, again, we have the basic technical safeguards in place that are covered in that initial security risk analysis, and also making sure we're keeping an accurate asset log of all devices that are storing and also have access to not only PHI, but also ePHI moving forward as well. The third key enforcement trend revolves around business associates. Before we get too ahead of ourselves, here's an actual quick refresher on who actually qualifies as a business associate and who should be signing one of these agreements with your practice. A business associate is defined as any organization that creates, receives, maintains, or transmits PHI on behalf of a covered entity. Some of these common examples include shredding companies, attorneys or legal groups, third-party billers, EHR companies, and even IT companies, to name a few. And so where do these business associates really come in? One key highlight from all those cyber attacks that we talked about a few minutes ago is that these business associates continue to find themselves victims, which in turn makes your data vulnerable and your practice possibly liable if you don't have those agreements in place with your vendors. So as far as business associate agreements go, the most important thing to note here is making sure we're identifying all of our business associates, especially anyone who will impact your practice's operations, is key here. And make sure you get an agreement signed. These vendors are typically the biggest targets for cybersecurity attacks because they typically don't have the same measures in place as that practice does. So it's essential to have these agreements in place, again, to offset the liability in the event of a data breach on their end with your patient data. Really good example, some specific vendors we actually know were affected last year. Crystal Practice Management, who actually Servers were managed by NetGain, who experienced a massive ransomware attack at the end of last year. To our knowledge, this event is still ongoing investigation, but it raises a lot of red flags about similar business associates and also vendors. So again, key takeaways: making sure we're getting business associate agreements signed before a data breach, before we continue on or sign that new contract with a business associate or vendor. Also making sure they're getting signed as they expire. We do recommend having these agreements signed annually. If you haven't done this in the past, it gets you in a good cadence, making sure you have the most up-to-date person on signing on the behalf of the organization, but you also can prepare these non-expiring. A lot of your nationwide or regional vendors are going to have these pre-prepared for you, so those may never expire, but your local and smaller regional vendors and business associates definitely going to want to have those signed annually moving forward. Now, I know we've also mentioned Patient Right of Access Initiative as a continued 2021 trend, but going beyond enforcement, this area is one key place your practice can succeed or fail when it comes to HIPAA compliance. I touched earlier on how important that documentation aspect is in the OCR's eyes, and this particularly important when it comes to patient record requests and also the request process. Several practices in some of that recent audit data could not show documentation on how they handled patient requests, and then the OCR's eyes basically picks or it didn't happen, right? But they're referring to policies in place. You can have proper measures in place and proper processes, but if you don't have those proper policies and procedures in place to document how you request that information, in the government's mind, they don't exist at all. So something totally new in 2021 is the Office of National Coordinators for Health, IT, or ONC's interoperability and information blocking rules. These rules are effective as of April 5th of this year, and they involve requiring providers to give patient access to their EPHI more easily, include sharing a variety of clinical notes and other defined data elements considered EPHI. And additionally, a huge part of the rule is to prevent sharing information with other health data applications or HIEs where there's no reason not to share that data, but many providers currently limit their data exposure. Ultimately, there's a lot that goes into the information blocking rules, but the biggest takeaway is to start thinking about updating your process now to adhere to these new requirements. And again, properly documenting those changes and documenting those processes. So now that we've talked about some key enforcement areas of focus, let's take a step back and take a look at the bigger picture on where HIPAA law is headed in 2021 and also moving forward after that. HIPAA in 2021 is going to be another big year for enforcement. And the change with 4 big legislative updates either already set in motion or coming soon. On January 5th, the government kicked off their new year, new law resolution by enacting the HIPAA Safe Harbor Law. We spoke about that earlier. They're incentivizing practices to meet those minimum standards, understanding things happen, and also reduce your risk of a potential fine or an audit. As mentioned, this amendment, again, incentivizes practices to achieve basic security measures, particularly with the climate of growing cyber attacks and growing patient complaints as well. It requires practices to comply with a HIPAA security rule and implement appropriate technical safeguards for any vulnerabilities identified on that risk analysis. But again, the good news there is if you can prove your compliance for at least 12 months, they understand things happen, they're gonna minimize the audit process, minimize fines, and minimize the corrective action plan, more than likely all 3. In addition to the HIPAA Safe Harbor Law, the 21st Century Cures Act recently came into effect on April 5th as well. The Cures Act is a complement to the existing HIPAA laws designed to further outline how practices and healthcare app providers should be navigating the balance between providing patient access to their EPHI while also maintaining their data privacy and security. Some of its most notable highlights include improving and providing patient right of access to their health data, reducing the regulatory burden on patients, and also preventing information blocking. We feel that in the future, this is going towards a patient portal in the future. Again, trying to remove that burden from the provider and actually giving more power to the patient to access their records. While these two laws might be new news to you, the current public health emergency is also something we know a little bit more too well than others, probably, right? The COVID-19 pandemic. While the public health emergency has also been extended quite a few times since it was first declared last year, it's also been extended yet again. So while the health emergency remains in effect, we still want to maintain the importance of practices to be prepared for when these waivers do actually expire, and limited enforcement discretions do finally expire as well, and ensure that our practice is meeting these HIPAA standard requirements for things like, again, PHI disclosure and also telehealth use. Those were some of the biggest waivers in place during that COVID-19 pandemic as well. And lastly, and certainly not least, just this past December, the OCR proposed some big changes coming to the HIPAA privacy rule to be better meet the rapidly evolving needs of patients and providers, and also the introduction of more and more technology into healthcare. Just a few of these proposed changes and modifications include potentially shortening covered entities' required record request response time to no later than 15 calendar days, which is again currently 30 days. They're also going to be potentially eliminating the written acknowledgement requirement and modifying content requirements for the notice of privacy practices. Also specifying when ePHI must be provided at no charge, and also requiring the posting of fees if there is any at all. While these changes are only proposed, the OCR just recently announced a 45-day extension for public comment period on the law updates due to the high public interest. With this being said, while compliance won't be mandated for quite some time, we can expect a lot of changes to come into effect once that final rule is published and set into motion. So it's important now, more than ever, to get your practice up to speed. So what do all these policy updates tell us? And they should tell you again, the government is focused on HIPAA compliance and strengthening areas that have proven to be major red flags and also gaps in the past in health organizations across the country. So with this in mind, we really want to make sure you're asking yourselves and asking your practice yourselves these questions moving forward after today. Are we completing, maintaining, updating that first phase of compliance, that security risk analysis, identifying gaps in compliance, understanding where we have areas of risks, and continue to mitigate those risks going forward? Do we have proper policies and procedures in place, documented, maintained, updated, drafted specific to our practice, and also our North Carolina specific HIPAA laws as well? Also, are we completing and maintaining HIPAA compliance training? Minimum once per year, all employees need to be trained within the first 30 days for new employees. Are staff trained well in avoiding cyber attacks like phishing emails? And lastly, are we staying up to date with the latest HIPAA changes? As we showed, HIPAA is a constantly evolving law. There's current changes. Are we staying up to date with these latest changes? And the last question on the list is obviously one of the bigger ones, right? If there was an audit or data breach or a patient complaint tomorrow, we want North Carolina Dental Society members to feel comfortable and confident in their documentation, in their ability to pass that audit. We don't want you to hope that you're compliant. We want you to know that you're compliant moving forward. So if some of these areas are a little concerning to you, you're finding yourself pondering, how in the world am I going to maintain all this documentation? You're absolutely not alone. So to end us today, to kind of give you another reason why the NCDS is so excited about our partnership with Abyde, if these questions are hard to answer, we have a solution for you. What we've actually done is we've developed a revolutionary software to simplify this compliance process. And to give you an idea on just how we've actually done that, to give you a peek at our solution, this is Abyde.com. You can kind of think of this like the TurboTax for HIPAA compliance. It's going to fill any gaps that you may have in compliance, get your practice fully up to speed, and also maintain this compliance process automatically moving forward. It's completely cloud-based. You simply log in. You have immediate access to your HIPAA dashboard where you have everything you need right at your fingertips to meet all of those government minimum standards. Everything is at your fingertips. And the best part about all of this, it's totally automated. It's going to send you an automatic email through our notification center. It's going to tell you what to do, when to do it, how to do it. You do not have to be a HIPAA expert. It's easily delegatable. And again, 5 to 10 minutes a month is all it really takes to maintain compliance. All you simply do is you add your practice's profile information into the profile, you add your practice's physical information, upload your employees, and you're off and running. We're going to walk you through the risk analysis in 20 minutes. We're also going to walk you through mitigating risk throughout the year. We're going to dynamically generate and maintain all of the required policies and procedures. We're also going to send out automatic HIPAA compliance training once a year to all your staff and all new employees. And if you're concerned with those business associate agreements, all you have to do is add your vendor's information. We're going to draft those agreements, send them to your vendor. They sign them electronically. They automatically upload into the system. And the two best things about our solution and what most practices across the country love about Abyde is our ongoing support and our audit protection. Kind of think of Abyde as a consultant with a really cool solution. We know day-to-day questions come up. Patients ask weird questions. Weird scenarios come up. You're not sure how to interpret something. Our amazing support staff is on call. Call us, email us. We're happy to walk you through that weird scenario. And best and last but not least, hopefully something no one on the call ever has to use, but it's our safety net and our built-in audit protection. If you do have a data breach or a patient complaint or a government proactive audit, you click that big red button. One of our HIPAA specialists is going to reach out to you immediately. We're going to find out who's auditing you, what they need from you, what they need from us. We're going to walk you step by step through the audit process. And we're happy and extremely proud to continue to say that every Abyde user that has been through a HIPAA audit has not paid a single dime to the government. So overall, Abyde in a nutshell, this is going to take you less than 10 minutes a month to maintain compliance. You're going to have that confidence as HIPAA continues to evolve that your practice is continually meeting those minimum standards from the government. And this is being maintained in the background with minimal effort on your end. So just wanted to give everyone an idea of what we actually can help with on the back end. Our main goal would be to reach out to everyone individually, give you a full demo of our solution, help you identify any gaps in compliance, but we are here to be a resource to you moving forward. That ends our presentation for today. I will gladly stay on to answer any questions, but feel free to stay on, send questions in the chat. If you have any questions about any of the requirements we discussed, any updates we discussed on our automated solution Abyde, please feel free to stay on, ask questions. I'm actually going to put my direct contact information on the screen. So any questions you may have, feel free to call us directly. You can send me an email directly as well. I'll actually put my direct phone number on the screen as well for everyone. It's going to be, you can send them to colemorgan@abyde.com. That's one of our other representatives. You can send those direct emails there as well if you have any questions at all. Again, thank you everyone for your time today. We are here to be a resource.